This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Mon Health Talk for this Monday. Thanks for joining us. This is Mon Health Talk Radio. We've got a couple of guests. First of all, I'm Kyle Wigg sitting in for Dave Wilson, who's off today. He'll be back next week. We've got a couple of guests with us. Maggie Wright, Systems Senior Director of Quality, Senior Director of Quality Mon Health Medical Center, and Addy Morris. She deals with the sepsis and stroke care. And first of all, ladies, good morning. We'll start with you. Maggie, good morning. Thanks for coming on.
Good morning. Thank you for inviting us.
And Addy, thanks for your time this morning. We appreciate it.
Good morning. Thank you.
We'll start with Addy. Give us a little background, your education. What are some of the things that drew you to the Mon Health system?
Absolutely. So I'm actually born and bred here in North Central West Virginia. I started my nursing career actually at the MTech facility where I obtained my LPN. Then I went back to Fairmont State and received my RN and BSN degrees. I have been very fortunate to be able to provide care and take care of our lovely community for the past 23 years. When the opportunity was presented to work at Mon General, I couldn't think of a better place to go and use my experience. I was really excited that the sepsis and stroke role was available because we've all had family members or know someone who has been affected by a sepsis or a stroke or both at the same time. And my ability to affect the quality of care that Mon General already gives, which is excellent, and be able to strive and reach higher goals and higher levels of care through the Mon Health family, I was so excited to be able to work with that community.
And what does your job entail? What are your day-to-day duties?
Well, as a sepsis and stroke coordinator, I follow our patients throughout the hospital to make sure that the care provided is best practice and at the highest level. I provide education to our nursing staff and the patients when they're diagnosed with strokes. I also provide education to the providers and make sure that we're all on the same page, that we're all working together as a team, and we're all striving to serve our community like a family.
And Maggie, same for you. Your background and what's your area of expertise?
My background is a bachelor's degree in nursing with an MBA with a dual specialization in risk management and health administration. I'm actually from upstate New York. When I found out that there was a quality and patient safety position open at Mon Health, I was very excited because it's very important to me to work for a facility that truly considers quality and patient safety to be a top priority, and that is what Mon Health is all about. So I'm very happy to be part of the Mon family and to continue to drive patient and quality excellence.
Okay, May is Stroke Awareness Month, and for both of you, but we'll start with you, Addy. Obviously, this is a condition, like you say, everyone's had a family member, everyone has had someone that they know that has been affected by this. What are the statistics in terms of West Virginia? I would imagine that unfortunately, West Virginians, people in this area, are probably statistically more apt to be affected by this condition.
Absolutely. So West Virginia is ranked 7th in the nation for the prevalence of strokes. A lot of that is related to a lack of health care, primary care physicians and stuff in the area. And, we come from a demographic where people don't like to go to the doctor unless they feel really sick. So they don't do that preventive care like with hypertension, which is the leading cause of stroke. We always say a stroke can happen to anyone at any age, at any time, and being able to identify the signs of a stroke and getting help as soon as possible can save lives. Our motto is time lost is brain loss. So we want everyone to kind of know the signs and symptoms. At Mon Health, we use the acronym BFAST. And BFAST stands for B is for balance. So if you feel a little wonky on your feet, maybe a little dizzy, E is for eyes. You lose vision. You see spots, any visual changes. F is for face. You see a droop in your mouth and your eyes. Maybe your family notices it first. And then we move on to arms. So one of your arms you lose strength, or you can't quite raise it right, or grip a glass quite right. Or you may notice a change in speech, and that doesn't just mean slurred speech. That could be not being able to find the correct words. You're trying to explain something to someone and you just can't get the words out. And T stands for time. So as soon as you notice any of those symptoms, only takes one symptom. Don't wait for the second one to appear. You need to call 911 and get evaluated so you can get to the appropriate facility and get treatment as fast as possible.
That's pretty thorough. That's a very good description. Maggie, anything to add to that?
One of the things that we do see is that a lot of people, when they have these symptoms, they either drive themselves to the emergency room or their loved ones drive them in, and it's really, really important to call 911. And that way EMS can assess the person immediately and get them to the hospital quickly, and also let us know that we're coming so the team can be waiting for them when they get to the facility.
Okay, what about risk factors? I know the first one, Addy, is always smoking. Just stop smoking. Smoking increases your risk of about everything bad, correct?
Absolutely. Vaping, smoking, all of it. Quit putting things in your lungs that do not belong there, only oxygen. So we want to see our family members encourage each other to stop smoking together and get away from those vapes as well. We also want to see people go to their primary care physicians on a regular basis so they can check their cholesterol, they can check for hypertension, and they can do those preventative measures. And, of course, get out and get walking these beautiful hills of West Virginia. We have great walking, great hiking in our area. And just a little bit of exercise every day can prevent strokes greatly. Yeah,
so get out and exercise. Again, keep an eye on that diet. It's okay to treat yourself occasionally, but fruits and vegetables, those are the type of things that you'd like to emphasize. Exercise, stop smoking, watch that diet. Maggie, take a moment and talk a little bit about the hospital's preparedness for somebody. You get that call, somebody's got the symptoms of a stroke and they're headed your way. The hospital's ready.
Absolutely. We have a team that we utilize for code stroke, and we bring people immediately to CAT scan. They have an assessment. We do the CAT scan, and then we coordinate with neurology to see what the best treatment is for that patient, and then make sure that we are able to give that treatment or transfer the patient as quickly as possible.
Mm-hmm. And again, watching, obviously both of you are trained to see these symptoms when they develop, but do they come on quickly, or are there some things to look for? There's some indications that maybe someone's in trouble before these serious symptoms begin. If you understand what I'm asking, Addy, what should people be looking for?
Well, again, we want to look for those risk factors and kind of know that with those risk factors, there is a high risk of stroke. So if you do see any of those BFAST symptoms come on, you get care as quickly as possible. You may notice also some people will notice that they have a headache. Some people will notice that they start feeling numbness and tingling in the arm before they get the real weakness signs. But really, a stroke, the way it works and the way the clot works, when it blocks that blood vessel, it actually acts quite quickly. Those symptoms are going to come on quite quickly. And time is so, so important when it comes to a stroke. Again, we cannot stress that enough. The special medication that we can give to people who qualify has to be given in a very small window. So as soon as you can get to the hospital, as soon as you can get to our Mon Health family team of stroke providers, the quicker we can dissolve that clot, take care of that clot, and hopefully reduce or totally eliminate any long-term effects of the stroke.
Okay. Elaborate on that a little bit, Maggie. Addy talked about a special medicine that's available, I guess a declotting medicine, for lack of a better term. How has that evolved in terms of that treatment and that type of medication?
That type of medication was a medication that was used initially for patients that were having heart attacks and, moved on to people with pulmonary embolisms. But we found it works for people that are having a stroke as well. And as Addie said, time is of the essence because of the short window of time that medication can be given and be effective.
And one more for you, Maggie, before we take this next break. Talk a little bit about the hospital's role in relation to treating patients. Again, medicine has evolved quickly and rapidly. Some of these things, some of these practices, I would imagine, have been in place for many, many years. But the evolution of treating stroke patients, treating them quickly, treating them effectively, what sort of advances have been made recently?
We've done a lot of advances, and one of the things that we're really proud of is having a company come in and look at our program and the advances that we've made. And we became acute stroke ready certified with the Joint Commission about 2 years ago. And we recently had our stroke survey with D&V. So we're very excited that they can come in and look and show that we have the appropriate equipment and can take care of people in a fast, effective manner, which is what they come in to look at.
Right. Addie, anything to add to that?
No, I think Maggie said it best. We, we look at our processes every day. We actually sit down and we evaluate how we treat our stroke patients so we can always provide the best practice and we can get them into CAT scan as quickly as possible. It really is a team effort. Everybody in the hospital responds. Everybody in the hospital is prepared, from pharmacy to radiology to the ER team and the ICU team. We're all ready and waiting when that stroke code comes in to provide our community and save some brain.
Mm-hmm. This is Mon Health Talk for this Monday. Thanks for joining us on WHAR. Our guest, Maggie Wright, Senior Director of Quality and Patient Safety for Mon Health Systems, and also Addy Morris, the Coordinator, Sepsis and Stroke Treatment at Mon Health Systems. We'll take a quick break. We'll return with the conversation on Mon Health Talk after this on WHAR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Mon Health Talk Radio for this Monday. Thanks for joining us. Our guests are Maggie Wright, Senior Director of Quality and Patient Safety, Mon Health Systems, also Sepsis and Stroke Coordinator, Addy Morris. And we're talking about how to prevent these things, how to prevent stroke in particular. And as we rejoin the conversation here, Maggie, let's talk about that specifically and the risk factors: smoking, a poor diet, lack of exercise, stress. What type of programs does Mon Health System have for people who are trying to lose weight, trying to reduce their stress, trying to quit smoking? What does Mon Health offer for these folks who are trying to prevent these types of catastrophic illnesses?
We have providers that are always available and ready to help anybody who needs assistance with that. We also have nutrition specialists, and we have a lot of education that we can share related to diet and smoking cessation to help everybody to become their most healthiest self.
And Addy, if you can continue on with the thought there, obviously the smoking cessation, that's very important to prevent these type of illness and all these other things we've talked about as well.
Yes, in addition to the education that the nursing staff and I provide to our stroke patients, we also encourage them to use the West Virginia Stop Line. For that, the providers also do counseling while they're in hospital to determine if they're appropriate for a medication to help quit smoking, kind of assist with that. And of course, I provide my personal information to the patient before they leave, so they can contact me with any questions or if those services aren't meeting their needs, that we can find something to help them out.
Okay, Addy, what about the other side of this? Obviously, a big part of the healthcare and your job is to help people recover after they've had a stroke. And again, with the sepsis they're dealing with, what's in place or what type of protocols are there to help people recover?
Well, as soon as they enter our hospital as a stroke patient or possible stroke patient, we actually go ahead and get physical therapy, occupational therapy, and speech therapy on board for them, so we can start evaluating their needs as soon as they're possible, usually within the first 24 hours, so we can start a discharge plan. That discharge plan may require going to an inpatient rehab facility such as Encompass or a skilled nursing facility in the area for additional physical therapy before they go home. Some only require some home health with a physical therapist that comes out to the home. And some people, that we get them in time, we get to treat them in time, and the only thing they require is maybe some outpatient physical therapy to regain some of the strength and mobility they may have lost while they're having their stroke.
So every situation and every patient is different, and that's part of the process as well, right? Tailoring it to each individual's needs.
Absolutely. We look at every patient as a family member, and we want the best for that family member in their unique situation. We look at where they live. We look at their home situation. We look at their drive time, if they're even able to drive themselves to therapy. We look at all those situations so we can make the best plan so they can get back to their lives.
Maggie, where can people learn more about what we've discussed here today?
They can go to monhealth.com where there can be more information. And we're just very happy to be able to serve our community because our mission is to enhance the health care of the communities we serve, one person at a time.
And what about a phone number to reach yourself, maybe to reach Addy, to reach some other specialists there at Mon Health?
Sure. My office number is 304-598-1983. And Addy, I'll let you give your number.
My phone number is 304-285-2802.
All right, very good. Some great information today. We certainly appreciate your time. We've been visiting with Maggie Wright, Senior Director of Quality and Patient Safety with the Mon Health Systems, and also Addy Morris, Sepsis and Stroke Coordinator with the Mon Health Medical Center. Ladies, we appreciate your time again. Thanks, and we'll talk to you again.
Thank you. I hope everybody has a meaningful Memorial Day.
Absolutely. A wonderful Memorial Day out there, and we certainly second that opinion. Maggie Wright, again, Senior Director of Quality and Patient Safety, and Addy Morris, Coordinator, Sepsis and Stroke Preparation and Recovery at Mon Health Systems, our guest on Mon Health Talk today. We do wish everyone a happy Memorial Day, and thank you for listening to Mon Health Talk Radio for this Monday on WAJR.